because I don't want people to be suffering like me. You know, it's so upsetting to see somebody that you can't help. I just love him, I miss him so much.
George Elliott died in 2023. The cause, an industrial lung disease called silicosis, after 40 years inhaling toxic dust as a stonemason. Now, George's family are calling for better protection for workers.
It is the next asbestosis health crisis, and we definitely need to be doing more about it.
And an MP is proposing a change in the law.
Got to make sure that all the facts are in the public domain and that everybody can get access to PPE and that they will be protected from getting this awful disease.
This is their story.
2022 was a lovely time because we moved down here thinking that we were going to have a lovely time, relax and whatever. But then come middle of 23, that's when his health started deteriorated so quickly. He was on oxygen all the time. And poor George, he was, just shattered. And you wouldn't want no one to see it. There's George.
George's skilled craftsmanship saw him work behind 10 Downing Street's famous front door. But only after a post-mortem did his family get a clear picture of why he died.
How did you feel when you saw the cause of death listed on George's death certificate?
Devastated, because I thought that George just died of a scarring of the lungs. But to see that it was silicosis is unbelievable.
And what do you think was the dangerous aspect of his job that he was doing?
I would say maybe cutting the stone. If it was just that much out, George would sort it out, get his chisel out or the grinder and things like that, but he would do a good job.
So they come to see us to get checked out.
The rising number of tradespeople experiencing symptoms has led to a dedicated silicosis clinic being set up at London's Royal Brompton Hospital.
So these are 2 CT scans. This is somebody who's got earlier form of silicosis, and what you can see is lots of little nodules. So this is where someone has breathed in the silica dust, their body has tried to attack it and has formed these little areas of scar tissue. If this disease progresses, what we can see is this sort of silicosis. And this is where those little nodules have come together to form these bigger masses.
The country's leading doctor in researching and treating the disease blames the increasing popularity of man-made or engineered stone.
Different stones contain different concentrations or levels of silica. So something like marble contains very low levels of silica, maybe less than 5%. A product like granite contains about 30%. And what we're seeing now over the last 20 years or so is emergence of artificial stone or engineered stone, sometimes called quartz. That can contain up to 95% silica.
And how strong is the evidence between working with products that contain silica and developing silicosis?
So we only ever see silicosis in people who work with this product. So if they're present in your home, in your building, in your workplace, they are not going to cause you any harm. The risk is to people who are cutting, grinding and polishing these products on a daily basis for several months and years.
Industry is increasingly alive to the risks. Here at Classico Marble near Windsor, they run training sessions on best practice and sell advanced cutting machines with water jets to catch and wash away the harmful particles.
Just in the last few weeks, the Health and Safety Executive have banned the dry cutting of engineered stone without vital water suppression like this. Australia have gone even further, outlawing quartz countertops entirely. You work with industry, but what's your message to consumers who are maybe getting quotes right now for new kitchens or new bathrooms?
If it is too good to be true, and the price is low, question it. If they're a responsible fabricator, there is a cost in that process, to it, but just go and visit. Like we have today, we've walked around and within seconds you can see a reputable process.
So that's George there.
That's it.
Back in Bexhill, Sandra's sisters are supporting her call for workers to be better protected.
It is the next asbestosis health crisis, as far as I'm concerned.
Yeah.
And we definitely need to be doing more about it, getting the word out there, because all of us have got kitchens, all of us are having this engineered stone, and I don't think the general public really know what goes on behind the scenes.
And also I think the people that engineer it
Yeah,
don't
no,
as well.
no.
You know, people that are working on sites and stuff, they go home and,
Yeah.
you know, there's
Yeah.
dust on them and stuff like that. I don't think men are aware of what
The implications
Yeah, yeah.
of their work.
Presentation of bills, Liz Jarvis.
The family's campaign has made it to the floor of the House of Commons,
Silica dust exposure bill.
with a backbench MP from Hampshire proposing a change in the law.
My constituent Caroline contacted me last year about her brother-in-law George.
Liz Jarvis wants greater prevention, monitoring and reporting of the disease.
We've got to make sure that all the facts are in the public domain and that everybody can get access to PPE and that they will be protected from getting this awful disease.
The government says it's tackling this issue head on to make sure workers are protected.
Why is it important to you to campaign and to raise awareness?
Because I don't want people to be suffering like me. You know, it's so upsetting to see somebody that you can't help. I just love him, I miss him so much.
And how do you like to remember him?
His smile and his sense of humour. Yeah, his smile and his sense of humour.
Some argue only a total ban of silica-packed synthetic stone will ensure more tradespeople don't lose their lives simply for doing their job. Kit Bradshaw, ITV News, Bexhill-on-Sea.